Hi, this is Don Deems, the Dentist Coach. Thanks for stopping by for the Dentist Coach Insider Strategies. I hope you'll find today's insider strategy useful in your life and practice. My best wishes to you. Hi, this is Dr. Don Deems, the Dentist Coach, and today's blog is about 6 elements to improve your treatment presentations. This always seems to be an area that many dentists struggle with. I've seen and listened to many dentists over the years present treatment to patients quite ineffectively. And needless to say, if you're unable to present treatment plans in a very honest and forthright and caring way, then chances are, unless the patient is hurting or unless they just are dying to have the treatment completed, you're probably not going to have much success in terms of patients accepting your recommendations. So I've got 6 elements that I want you to consider when you're presenting your treatment plan. The first point that I want to make is that you have to do a very thorough examination to start with. Being thorough means a lot to patients. And so if you're thorough, you're building trust. You're also able to make a complete treatment plan, which is going to save not only you embarrassment and time, but also the patient time and money. So remember, do a thorough treatment plan before you ever present any sort of a treatment plan. The second thing is that failure to really hear what the patient is saying. Many of you may remember years ago that somebody from Reader's Digest or journalist went around to 50 different offices all over the country, and they saw the dentist and a dentist, and showed a series of X-rays, an FMX, and the article then that they wrote talked about how dentists essentially were, some dentists were, either underdiagnosing, under treatment planning, to others who were just downright greedy. Of course, some of that may have been a little bit true, but the reality is what the patient wants is what's most important. And yes, we do have a moral, ethical, and legal obligation to inform them of all their situations. However, if you're not really listening to the patient, then whatever you're saying to them ultimately during your treatment presentation is going to go one ear and out the next. Now, the third point that I want to make to you is, hurrying this presentation process. You've got to take your time in terms of collecting the information, setting aside the time on your schedule to do a thorough evaluation. And if you don't, then patients are going to feel like they're being herded in to see what you have, like that you're some type of lottery person. So don't do that with people. Take your time with them, help them understand what you're looking at, what you're finding, etc. The fourth point that I want to make is a mistake, in my opinion, and that's having someone else make the treatment presentation. I want you to think for a second. Let's say that you've gone to your physician, your cardiologist, and you're told you need a triple bypass surgery. Would you feel comfortable if the nurse came in and said, "Oh, I talked to the doctor, he said you need a triple bypass, so we're going to get you scheduled for that"? Would you like that? Don't you think you'd have some questions? The same thing goes in dentistry, and only you, the dentist, are the most qualified to answer that. Now, sure, some other team members may be able to handle some of the other things like insurance or making arrangements for fee payment, etc., etc. but it's you that needs to be the one answering their questions about treatment, not somebody else. The fifth point that I want to make, and this happens a lot, is confusing the patient. Some people will say out there, oh, you should only present one treatment option. Well, you know what? There is a lot of ways through the forest. And who is it for us to be telling a patient that it needs to be done this way and this way only? There are multiple ways of doing that, and yes, I understand it takes a little bit of time to go through all those. So you don't want to confuse patients. You want to use language that they understand, lay things out in the way, answer their questions, and then let them decide what the best route for them is. Don't force something down a patient, because not only will they perhaps just go somewhere else to somebody who will listen to them, but if things don't go perfectly in their mind, they're more likely apt to point a finger at you, and even worse, sue you. Now, the last point that I want to make is when you're sitting down to actually do the presentation, don't rush this. Start by checking in with that patient and asking them, what questions do you have from our last visit? What concerns have come up? What are things that I may have confused you about this last time? Chances are you probably did. So take your time by asking those questions first, and then sit down and talk to them about what you have planned based on what they've said, the options that we've talked about, what their concerns are, and what their situation is. And so if you will take these 6 elements into your treatment presentation process, you're going to be much more effective. You're going to have happier patients who are going to give you great reviews, and they're going to love you because you're the only person who's probably ever taken time with them to help them understand their situation, help them understand how to get through getting the treatment that they want and need. So I hope today's Insider Strategies help you. Please feel free to call me at any time. Go to my website, you'll see a contact number. You can email me. I'm here to help you in any way that I can. Thanks a lot. Thanks for watching today's Insider Strategy. I hope to see you around for future videos. If you have a comment, would like to ask me a question, or have a topic you'd like to see me talk about, please leave your comments in the box below. Thanks again, and my best wishes to you.